10.
Hello, everyone. We would like to start our webinar. I know the other registered participants will also be joining. Hello, Dr. Omar. Can you now speak if your microphone is now working? Hello, Dr. Omar. Hello, Dr. Omar. Are you using a earpiece? Well, it seems like you are speaking, but we can't hear you. All right. So whilst we wait for Dr. Omar to sort out his microphone, I would like to start with the introduction. Thank you, ladies and gentlemen, for joining us today on such an important webinar for the world. But it is not only for us in Africa, but it is for the world. We all know the issues that climate change is having on our continent and in the world. And it's important that as a continental body, we also talk about it and see how we can really help solve some of the challenges. It is not only having effects on the environment, but also on health. It's very important for us as health professionals to become abreast with the issue. And that is why AfriHealth has decided to have this webinar. And we have two important speakers on this webinar. We have Dr. Maria Nera, who is a Director, Environment, Climate Change, and Health from the WHO headquarters in Geneva. Joining us, she'll be our first speaker. We also have Dr. Yogan Pele, Country Director, Clinton Health Access Initiative, South Africa, also share with us their experiences. They are going to talk to us about practical issues, not theoretical ones, so that we can learn our lessons and then take actions from that. So without wasting much time, you've all seen their CVs already in the flyer. So Maria, I want to hand over to you to share your experiences with us. Thank you, and over to you.
Thank you. Thank you very much, Georgina, if I can call you Georgina. And sorry, Dr. Umar, that apparently we cannot hear you, but if you can hear me, a big warm hello from Geneva, from the headquarters of the World Health Organization.
You're welcome, I can hear you.
Oh, and we can hear you now.
Okay.
All right. So you take over from me after they've spoken.
No problem.
Thank you. All right.
Continue, Maria.
Okay, perfect. You see, it was a connection between the two technological worlds. Well, and a warm hello to all the Africans and colleagues connected today for this exchange. Let me maybe start with something that you say, Georgina. You said they will tell us about technical and practical issues, not political. Let me put a provocative sentence here. When we talk about climate change and health, nothing is more political. So we need to be prepared for that as well, because the decisions that are gonna be that will be taken in the next months or years are very much by the politicians, and I'm afraid the consequences will be on our health systems, on the health of our people, on the production of food, on the way we organize our cities, on the way we produce our energy. So I think we need to make sure that when we talk about the health argument for climate change, we are prepared to influence as much as possible with our practical and concrete work on influencing those decisions that are very political, but they can have an incredible impact in the health and well-being of our people. Just 2 minutes to recap what we know about climate change and health. And if colleagues, if participants, you need more evidence, I will invite you to have a look at the WHO website, where you have plenty of document presentations and scientific evidence proving how climate change is already affecting, unfortunately, in a very negative way, our health. And it's affecting our health on many ways. First, because it will cause or it will be associating and exacerbating and increasing the frequency and the impact of natural disasters. And of course, health will be suffering those consequences, but as well because it will be touching the 3 pillars of our health. If we destroy those 3 pillars, our health will be very much at risk. And those 3 pillars are access to food, water, the quality of the air we breathe, and then another one, which is the housing, the shelter, where we live and where we spend our as a society, where we stay. So those pillars will be kind of shaken by the consequences of climate change. And therefore, obviously, if you have a problem related to food production because there have been a flooding or there have been a natural disaster of another type, and you cannot produce food, as you can imagine, it's not just the agricultural sector or any other sector of our economy, but immediately will be our health as well. We will have even more malnutrition, undernutrition, and the effects will be the same with the access to safe and clean water. You know very well that without that access to clean water, our life will and our health will be very much at risk. So be conscious that is more than the direct impact of climate change, is as well how indirectly will touch what represent the pillars of our health. On the other hand, clearly certain diseases, and this is maybe the part that our colleagues or health professionals are more aware of, how the transmission of certain infectious diseases will be changing, how we will see more cases of malaria in places in Africa in particular, where we didn't see it before, because the weather and the climatological conditions were not allowing the mosquitoes to have a nice and enjoyable life, and they were not able to transmit malaria. So we will see now more of those infectious diseases. The other important part on climate change on health is the following, and I need your convincement, if possible, and your commitment to use this argument as well. If we tackle the causes of climate change, the benefits for the health sector will be enormous, because when you want to tackle the causes of climate change, what you need to do is to look at the sources of energy. What is causing now most of the global warming is the combustion of fossil fuels. The combustion of fossil fuels not only is responsible for the global warming, but is responsible as well for air pollution. And air pollution, as you well know, is responsible every year for more than 7 million premature deaths. Let me repeat it again, 7 million premature deaths every year caused by exposure to the bad quality of the air we breathe. So in that sense, I think this is one of our best arguments, is not only what climate change will be doing to affect our health, is how by tackling and stopping this nonsense of the causes of climate change, we can reduce those 7 million deaths that we have every year caused by air pollution and caused by this combustion of fossil fuels. And this is where, again, the geopolitical issues start. If the health sector says, okay, my role is at the hospital, and therefore I just treat the cases and the diseases caused by exposure to air pollution, I treat the patients, and probably I'm doing very well my job. But what we need to do is to stop this nonsense and all of those diseases and deaths caused by the fact that in Africa, the use of fossil fuels is still massive, and there are even investments to keep maintaining this extraction and use of fossil fuels, instead of accelerating this transition to clean sources of energy. Can any one of you explain me why Africa is not solarized? Why we don't have solar panels everywhere in Africa? The sun is for free and the technology is there. There are no excuses now for the technology, but of course, there are commercial interests that are stopping that quick transition to clean sources of energy and still keeping using fossil fuels, because the financial interests are enormous. And you and I, as the health professionals, we cannot simply keep treating the patients. We need as well to be into that debate, saying the combustion of fossil fuels is making our people sick, and therefore, as a health professional, I need to contribute with my messages to accelerate this transition to clean sources of energy. As an African, even more, you need to accelerate that for economic job creation and protecting the health of your people. So here is again the political part of that, which is very much linked to our work. As few years ago, or many years ago, or unfortunately in Africa, even today, we need to raise our voice as health professionals to accelerate access to clean water, sanitation, and hygiene. This is fundamental. If we want to have healthy people, we need to make sure that they will have access to safe water and sanitation. And this is very much linked as well to the causes of climate change. You need to have an efficiency in the way the water resources are used. Let me then move on what it could be our role in terms of our hospitals and our health professionals and their research. In few months from now, I'm checking the watch, in few months from now, there will be the COP28. You know, this year it will be, COP is the celebration, as you know, of the climate change negotiations, where the countries negotiate. Africa needs to play a very important role, because Africa is one of those continents that is already affected the most. And the health of the people is not, unfortunately, free from those negative consequences. So a reason why the health professionals need to be well represented at COP, raising their voice, and again, saying how our hospitals are full of diseases caused by the same causes that are responsible for the global warming. The health professionals, we can handle our hospitals, we can make sure that in our hospitals we have an efficient use of energy, an efficient use of water, and all the procurement, the plastic, and all of these materials that we are very much consuming on a daily basis at our healthcare facilities. We can, as doctors or as nurses or responsible health professionals, we need to start to look at the sustainability of our healthcare facilities, making sure whenever it's possible that we will have energy on our healthcare facilities, but energy coming from sustainable, clean sources of energy. If possible, solar or photovoltaic energy will be much better, less pollutant. We have a role as well, obviously, on looking and having an epidemiological surveillance of those diseases that because of the global warming, we see an increase of cases. And this takes us to the concept of One Health, where we need to look at the environmental determinants of our health, the environmental health, human health, and animal health, and see that that interconnection is fundamental. And unless we stop the deforestation, the trade, the very aggressive agricultural practices that we are having now, we will not be able to change the trends on how climate change will be affecting us. So my point here is that we can't, as health professionals, just watch what is happening, monitor what is happening, describing what is happening, but we need as well to raise our voices, making sure that the health argument is well represented at the COP. As I say, describing what are the impact, the price that our health systems are already paying. Most of our health systems, which are already on difficult financial situation, are the ones that are now coping with the consequences of climate change. We need to associate among ourselves. We need to make sure that in our universities, in our schools, we teach, we talk about climate change and health. We need to make sure as well that we use the health argument in the sense that if you tackle the causes of climate change, there will be enormous benefits for the health of our populations. So we need to accelerate this mitigation of climate change. We described already one of the benefits of this tackling the causes of climate change, which will be the reduction of air pollution and therefore the deaths and the suffering that it causes. The second benefit will come from the fact that if you want to tackle the causes of climate change, you need to have more sustainable food systems. And more sustainable food systems means healthy diet, and that means, again, an important reduction in the number of deaths that we are confronting today caused by lack of food or the fact that people is eating, using diets that are not the ones protecting their health. Every year, the production of food is contributing to the climate change, but every year we produce food, but 30% of that food that is produced, it goes to waste. And this is unacceptable. That's why we need to have a sustainable food system that will look at from the beginning, the pesticides, what we use on the agricultural practices. And then we need to make sure as well that we use and consume local, we reduce the transport of our food. We recommend our people healthy diets that are produced locally with an integrated and holistic approach to those food systems, trying to reduce as much as possible this waste of our food. And the third benefit will come from the way we will plan our urban spaces, our cities. And I finish with this one. If our cities, and particularly in Africa, the big cities in Africa are now very polluted, congested with traffic, and almost impossible to work and to keep an active lifestyle. So we need to join forces as health professionals with urban planners and city planners and mayors, and again, using the health arguments, try to reduce that congestion, traffic, promote the sustainable transport in Africa, and making sure that the use of energy is the one that will be the less pollutant. All of these transitions and opportunities will be described in COP28. I hope you will be all able to follow, to push on your own community, to influence as much as possible, because unless we stop the causes of climate change, our health and our health systems will be suffering the negative consequences. Thank you very much.
Yeah, thank you very much, Maria, for taking for the wonderful presentation. You have nailed the cap, because climate change, as it is multidisciplinary, interdisciplinary, and transdisciplinary. Going by our experience of working in the food sector, with Doctors Without Borders and in the World Health Organization, you have said it all. You really identified a solution as a clean energy. You also point the challenges, the main challenges, as use of fossil fuels. And you also identify the roles to be played by the personnel and also the hospitals in Africa. And also the importance of surveillance using epidemiological approach, and also about One Health. You also identify some benefits from the indirect effect of the climate change and the lack of food and other things. So we really appreciate your contributions, and you should be on standby to respond to the questions thereafter. Can I invite Yoga Pile, and also the next speaker to be on board? Thank you so much. Yoga Pile, you have the platform. Can you hear me? Can you please hear me?
Hello, I'm hearing you.
Hello, can you hear me?
Yes, we can hear you.
Okay, go ahead, Yogan.
Hi, I'm just wondering, can you see my slides?
It's clear.
Yes, we can see your slides.
Slides are visible.
Okay, because for some reason I can't see them, but I'll go ahead. So thank you very much for the invitation to present from the forum. I really appreciate it. I would like to start where kind of Maria left off. Ken Booz, Chelsea Hanisett, and I wrote in the British Medical Journal in October last year a short essay entitled A Wellbeing Economy Focusing on Planetary Health Ahead of COP27. And really we wrote it for delegates who are going to COP27 in Egypt. And we argued in that short note that we need a well-being economy to deal with all of those issues that Maria spoke to. And I can share the reference if people wish to see it. But in my slides, I have the following key issues that I'd like to touch on very briefly. And Maria touched on some of them already, and I will go through them very quickly in the interest of time. So what are the major challenges facing the planet? Why climate change is important for global health? I want to focus specifically on how Africa is affected by climate change with some data. what are the mediating factors? What can be done? What are the specific roles of global health practitioners and by extension health practitioners? Should we talk about global health or planetary health? Does it matter what we call these things? And then I want to return to the role of the economic system. What's the role of the economy in maintaining all the things that are contributing to climate change? And then I'll make some concluding remarks. I hope you can still see my slides. I'll just move on. So the major challenges facing the planet, and it's fairly clear, many people have said this, I won't be the first, that there is no planet B. So this is all we have until we can populate Mars, I guess, which is never going to happen anytime soon. So we have pandemics, and we've just had one more, COVID-19. We have inequities, significant inequities and growing inequities in many countries, including my own. We have conflicts in many parts of the world, and we have climate change. So we have a number of what can be called colliding conflicts, pandemics, challenges that we need to deal with simultaneously. The planet is burning up, and the IPCC has clearly demonstrated this, that human influence has warmed the earth at the rate that is unprecedented in at least the last 2,000 years. We've really damaged the planet. As a consequence, we are all going to suffer unless we do something about it with a significant amount of urgency. In terms of the impacts and what we can do to adapt and what our vulnerabilities are, I think the 6th report on climate change, really identified what these are, especially for health. And health workers need to know this, because if you don't know this, in terms of what the evidence suggests, we won't be able to act. So it's harmed both physical and mental health. It's add pressure on food systems, as Maria said already. It's increased inequities in access to nutritional food. There are tens of thousands of additional deaths already and projected to grow in Northwest and Central Africa in particular. Children, adolescents, in particular girls, as well as people with existing health conditions, are particularly at risk. And I think we underplay the mental health impact of the expected rise in exposure to extreme weather events and what their consequences are, displacement, et cetera, et cetera. And we're seeing it already, both on the Horn of Africa and in Northwest Africa. As the Sahara Desert continues to move southwards, there'll be significant pressure on population. As a consequence, you will find increasing conflict. And as Maria said, less water, for example. So there are specific areas of conflict, and Evans and Munslow talk about the arc of conflict in Africa. And we need to understand that it's not just religion and local politics, but also climate change and colonialism that have given rise to these particular conflicts, especially in this arc of Africa. The major contributors to warming, there are several of them, and this slide basically shows which they are, but you can see that carbon dioxide is a major contributor to global warming. But it's not just carbon dioxide, it's methane, and we know that the major production of methane comes from cattle and because of meat and milk production. So we've got to change our dietary habits. There's no question about that if we want to reduce methane exposure. Who are the major emitters? As we all know, it's the rich countries. Where are the major consequences of this? It's in the poor countries. So the low and middle income countries are the beneficiaries of carbon emissions, basically in the north. So this is a global problem. It affects all of us, but it affects us differentially. The global inequities in child mortality, and you can see from the slide, it is based in Sub-Saharan Africa as well as Southeast Asia. There's no question about where there is significant global inequities in child health mortalities, which means that public health and health workers in our part of the world, Sub-Saharan Africa in particular, need to pay particular attention to the major causes of child mortality, including the impact of climate change. Some examples in this slide of inequities in Sub-Saharan Africa. I think we all know this, but I think the numbers speak for themselves, and they are stark. Life expectancy in Europe and North America is about 77 years, but in Sub-Saharan Africa, it's just under 60 years. That's one example. Women's risk of lifetime maternal death is 1 in 37 in Sub-Saharan Africa, but 1 in 4,800 in Europe and North America, which means that the burden of disease is in Sub-Saharan Africa, but it's where we have the fewest number of health workers. So we've got to obviously look at what we need to do to reverse these in our lifetimes. Why is climate change important for health? This is, I think, a very nice picture. It summarizes, I think, some of the things that Maria has already said, but it includes things like injuries and fatalities and mental health impact, forced migration, civil conflict, malnutrition and diarrheal diseases, etc., etc. So it's a multiplicity of impacts that climate change has on human health, and of course, but on planetary health more broadly. But this slide really focuses on human health. As you can see, air pollution and its relationship with asthma and cardiovascular diseases is quite profound as well. In terms of the impact of climate change on health, I like this Haynes and Eby cascade, which shows two things. At the top, it shows exposure pathways to better understand what the precise exposure pathways are, as we understand it based on the evidence we currently have. And then at the bottom, it shows examples of health outcomes of those specific exposure pathways. And I think, health workers need to better understand this, and because we'll be working from health outcomes, but we need to understand the exposure pathways so that we can better participate, whether it's in in the next COP28, or at local level, in reducing some of these pathways or intervening in some of these pathways. The AFRO has, I think, some data as well, and this slide basically shows some of the data that AFRO has on their website on the weak in health infrastructure, some of the things about what we can do about emissions at the bottom of the slide, etc., etc. But what's fairly clear is that it's estimated that between 2030 and 2050, climate change is expected to cause approximately 250,000 additional deaths per year from malnutrition, malaria, diarrheal diseases, and heat stress. So I think we need to be able to intervene so that we don't have these 250,000 additional deaths. This slide shows how Africa is affected by climate change. It's suggested by the World Bank that 42 of 48 countries in Sub-Saharan Africa rank amongst the most at risk for negative health outcomes associated with climate change. 88% of our countries in Sub-Saharan Africa. And the impact of climate change is gendered. And I think this is a very important point to make in our context. There's a greater impact on women because they are subsistence farmers, they head households, and of course there's biologic vulnerability, especially during pregnancy. And we know that there's a significant impact on children and the elderly. And children and the elderly are highly vulnerable in the African context. It also has an impact on our GDP, and this is a suggestion from Brookings on the impact of climate change on GDP over time. And you can see, if you look at the specifics, there's significant estimated impact on GDP, which means that Africa will become poorer in the next 20, 30, 40 years. So we have significant inequities. We are poor, we're going to get poorer. So countries most affected by air pollution and climate change, according to the World Bank, are reflected in this slide. And it's not surprising that 38 countries in Sub-Saharan Africa, specifically Burundi, Eritrea, Ethiopia, Somalia, Niger, Gabon, and Madagascar, are going to be significantly affected by climate change. The next column shows you air pollution. And again, you can see 40 countries in Sub-Saharan Africa are going to be identified as pollution hotspots. And in the final, in my extreme right, shows Sub-Saharan countries which are highly vulnerable to health impacts of climate change and or air pollution. So there is no doubt from what we know that Sub-Saharan Africa in particular is going to be significantly impacted by climate change and air pollution. There are mediating factors, and I think this is a very nice slide in terms of what can we do practically. And I'd like to focus on the health impacts, which are on the extreme right-hand side, which focus really on undernutrition, drowning, heart disease, and malaria. And on the extreme left-hand side is climate change with respect to precipitation, well, lack of it, heat, floods, and then storms. And then you can see in the middle what are some of the mediating factors, both in terms of the environmental conditions, the social infrastructure, and then public health capability and adaptation. And I think that's what we need to focus on. We need to focus on warning systems. We need to focus on socioeconomic development, health and nutritional status, and then, of course, primary health care. And I think what's true in terms of what we can do is really strengthen our primary healthcare system, but in an integrated way, as suggested by the Sustainable Development Goals and others. The burden on human health is reflected in this slide. And you can see that there are areas that are significantly affected by heat-related mortalities, according to. Now, the challenge of the gray areas is that there is no data. So it's not that Africa is somehow escapes what Brazil is going to go through. The problem with Africa, besides Southern Africa or South Africa, is that there is no data. And that's the biggest problem. We need more data, and health workers need to generate this together with researchers. There's very little published research on climate change in low and middle income countries, and this is basically a reflection by Steelberg on what he found in 2021. And again, you will see where there is a lot of data, or at least research, and where there aren't many. In terms of the impact, a research review in South Africa found only 34 papers on South Africa. And this quote suggests that significantly few studies used empirical data from health services to analyze the impact of climate change. So we need to, and health workers have to do this. What exactly is the impact? How is the demography and the epidemiology changing? So let me come back to the role of health workers. We need to become planet friendly, both as academics and as practitioners. Research, as I said, on climate change, on the planet and on health needs to expand. We need South-South partnerships, and we need to share research throughout these South-South networks. We need to advocate for mitigation and adaptation interventions, and we need to engage the decision makers. We need to bring climate change into undergraduate and postgraduate curricula. We need to make universities climate friendly and advocate that all buildings, whether the universities or health buildings, that we need to become climate friendly. We need to show, as both academics and health providers, that we can motivate for health climate friendly infrastructure. We need to make services planet friendly. We need to decrease the carbon footprint of health services. It's estimated that about 5% of emissions are related to health services, logistics, production, etc. You need to use practical examples to show how we can become climate and planet friendly. So one example, which was shown at the World Health Summit last year, was to offer plant-based foods during conferences and meetings. I suggested this to some of my colleagues, and I must say it didn't go down very well. Africans, by and large, love meat, but that's going to be the death of us, both in terms of the impact on climate and impact on our cardiovascular system. So we need to move to more plant-based foods. I thought this was fascinating. So a group of emergency medicine physicians met in 2021 to try and figure out what their contribution to climate change is. And this is reflected in a workshop that the outcome of a workshop that they had in 2021. And I think that this is an example of what not just, all public health specialists, all health workers should be engaging with. And I think this is a very good example of what a particular discipline in medicine has done, but this is something that we can all do. So, there's a lot of discussion now about whether we should talk about global health or planetary health. I won't bother you with this. You might say it doesn't matter what we call it as long as we are action-oriented. But I like the definition of planetary health. which suggests that it's solutions orientated, it's transdisciplinary, it's a social movement focusing on analyzing and addressing the impact of human disruptions on Earth's natural systems, on human health, and all life on Earth. And I think Umar was suggesting this after Maria's presentation as well. So let's return to the role of the economy. Many have argued that our woes are the result of the particular type of economic system we have pretty much all over the world, that it's unfair, the rich get richer as the poor get poorer. And we saw that during COVID. The rich got richer during COVID. There's empirical evidence to show that, but that's a general reality, it seems. And I think most people have come to the conclusion that this state of affairs is not sustainable and that it's a major cause of climate change. And the question is, what are the options? The options are a green economy. We've argued for a well-being economy, and clearly we need significant redistribution of health within countries, between countries, and between the North and the South. So some concluding remarks very quickly. Keeping the planet safe means dealing with multiple challenges. The impact of climate change is just one major challenge facing human existence, but dealing with climate change will ensure a sustainable and healthy society and societies all over the world. There's a major role for global health practitioners and health workers in countries in both mitigation and adaptation responses. And, it might well be that we need to stop talking about global health, but talk about planetary health, because typically when people talk about global health, they don't worry about the environment, the flora, the fauna, and but thank you very much. I raced through it in the interest of time. Happy to engage in the discussion further. Thanks, bye-bye.
Yeah, thank you very much, Logan, for the wonderful presentation. You really capped the nail. Your opening remark of no having planet B, which is a clarion call for all us to respond to secure the planet we have for now. You've also been able to identify the major challenges that has impact on pregnancy and neonates. You identify the epidemics, the inequalities, the conflict, and the climate change itself. You also go ahead and also link the GDP with the inequality. And also in your own presentation, you suggest some ways out through a planet-friendly response, research, advocacy, policymakers engagement, and also curriculum of the learning institutes. So thank you very much for this presentation. So I would like to have the questions by raising up your hands. And then before you set out your question, mention the person you are calling the question to. So we'll take them one by one as time allowed. And you may also write on the site so that can be taken away home, or maybe later on can be respond with them. But let's see. Let's start by picking questions by raising, indicating by acting with your hands up, and then we'll be calling you to respond. Okay, can I have the floor for Elsie to be the president of the Africa Health? Go ahead, Elsie.
Okay. Thank you very much for the presentations, Maria and Jorgen. Those for us at AfriHealth, I think this is just the beginning, and we put this together so that we could sensitize our members about this topic, because we feel that we have not really addressed this in AfriHealth. And many of us are academicians. So it really touches all aspects of life. And I was just wondering if any of you have looked at curricula, especially Jorgen, in Africa for health-related curricula, if any of them are really looking at integrating or have integrated climate change into their curricula, because I think this is really important for us in AfriHealth. Thank you. Over to you.
Yes, thank you very much, Elsie. Before other person responded, in respect of the curriculum, it is really at the zero level or preferred stage. Currently, we are working on a book chapter that will encourage universities to participate in climate and health. And going by the search on the internet, you may hardly have a direct input from any university, well, you may be able to borrow ideas. That's what has been going on. So it is almost at a zero level. And it's going to be a very good idea if you can also consider this at the upper health. Anyone with any observation? Anyone to respond? Okay, Byron. Sorry for Kulan. Byron can have the floor.
Yeah, sure. Thank you very much for the presentation. I followed through. I noted that you mentioned the issue of methane, methane gas from animals, whereby you're saying we should have more of plant-based foods. How successful has it been maybe in other countries where we used to have more meat consumption? What's the acceptability like? And yeah.
Can you respond to him, Maria? Thank you.
I will do it with pleasure, but can you repeat the question again? I have some difficulties on hearing properly.
Okay, Byron, repeat your question, Byron, please.
All right, thank you. I'm saying here in Africa, we are used to meat mostly, and you mentioned the aspect of methane from animals. How acceptable has it been, like as a case study from other countries? We have done it successfully to roll out the plant-based foods. Say they have departed from meat-based products. What's the acceptability like from the community perspective?
This is a very, very good question, and very much on the political agendas and the discussion these days. There are two aspects of that. One is that in the case of Africa, for instance, meat consumption still represent the way to have access to protein intake that you need for a healthy diet, I mean, for a diet. So we cannot completely recommend a shift on stimulate people to become vegetarians until we have this replacement in terms of protein intake. However, of course, in different populations and looking at the way they consume, the community acceptance of that, and little by little we can promote more this different type of diet based on cereals or a plant-based diet. This is on one hand. On the other hand, the reduction of emissions, and particularly methane, has to come from a sustainable farming and the way there are certain methodologies now and techniques and technologies that will permit, probably reduce the methane emissions, and that will be more in line with sustainable farming and the sustainable meat production. But again, this is a dialogue and a strategic discussion that needs to take place and will require a transition for sure. But for educated people, for the sensitization on the importance of having different, diets that are reducing whenever it's possible the consumption of meat, that is very much on the table. Thank you.
Thank you very much, Maria, for the response. And in addition to that, the use of methane, it has been established to be more environmentally friendly than the fossil fuel, it has an established fact. Thank you very much for that. And also, we all are in absence of any other question or contribution. I would like to appreciate all the speakers and also hand over the forum to Georgia Eboa. Georgia, can you please take over? And Georgina, sorry, you can take over the speak, and thank you very much for meeting us, and until we meet again. Thank you so much. Georgia, over to you. Georgina.
Thank you, Umar. Thank you, Maria and Yogan. I have a question, and I think it's for all of us as people from the health professions education area. I wanted to see if we could hear from somebody who could share an experience of curriculum review based on climate change. Do we have anybody who would like to share an experience? Because that is what we need, incorporating climate change into our health professions education curriculum. So if somebody could share an experience for others to learn, that would be very important. But Success, your hand is up. Please go ahead.
Yeah, thank you. Not responding to the question, Georgina, so I don't know if...
Oh, no, please go ahead. Then somebody
oh.
can later respond to my question. So please go
All
ahead,
right.
Success.
Thank you. So thank you to the presenters for this wonderful presentation and for the opportunity to listen from you. So my question or concern is from Yogan's presentation, the effects of climate change are experienced more in the Africans and the Sub-Saharan Africa at large, or mainly. However, still in Sub-Saharan Africa, we are facing a challenge of things like limited access to electricity, that is hydroelectricity, and the solar is not working so fine, and it's not turning out to be a big solution. And when Maria was presenting, I think she talked about the pollution being one of the leading causes of death per year. And we know that these cars that use fuel, the petrol and diesel, are emitting a lot of fumes to the environment and to the atmosphere, which is leading to air pollution. And one way we can do away with that is by adopting the electric cars. Maybe that's, I'm just thinking out loud, maybe adopting the electric cars. However, linking the first point I made on this one is that we in Africa have challenges with electricity, in that some places in Uganda, let me speak on behalf of Uganda, do not have access to power. Even the actual power that we have, the electricity that we have. So how do we tackle such a scenario of fumes that are coming from cars if we cannot go for the option of electric cars?
Since Yogan's hand is up, I would let him respond to that, and then any others. Kashina, I'll come to you after that. Yogan, please.
Great, thanks very much. Just to pick up on a few points, I guess the first issue is about reducing consumption of food products that damage the environment. Obviously there needs to be a transition. It's not going to be a sudden thing because many communities are pastoral communities, and they depend on cattle, goats, sheep, camel, etc. For their livelihood. So, we've got to think about this a bit carefully. I mean, I was a bit flippant in saying we need to move to plant-based. It's really the middle classes and the people who can afford the higher cost of plant-based foods at the moment that are able to do it. And we have the same issue with respect to healthy foods relative to, what people have called high sugar foods, sugary beverages and confectionery, basically junk foods. It's the same kinds of things that poor people eat, things that they can afford and that are immediately available and that are high in energy. Unfortunately, those things are also bad for us. So we've got to, change the way in which the economy works so that we can produce healthy foods, but at an affordable price, and make it available to everyone, and make it also, the production of these healthy foods, economically sustainable so that people can sustain their livelihoods through producing it. So I think, those are the kinds of things we need to think about it. The second issue is about fossil fuels. And I think we all know that fossil fuels are bad for the environment. And we have in South Africa currently a blazing discussion about transition from coal, for example. We are exporting coal to Germany and Japan, at the moment, and we are certainly benefiting from our foreign exchange gains because we are exporting coal. Yet, on the other hand, we're saying coal is bad for us, but it's fueling our economy at the moment. So, again, we are talking about what's called a just transition. What does a just transition mean? how does the North help the South, or the high-income countries help low-income countries with the just transition? What does it mean, et cetera, et cetera. So these are ongoing discussions. I don't think there are any endpoints to these. These, you know, they've just about started. I think we're late out of the blocks, some of us, including South Africa. But I think we've got wind, sun, and hydro, including in Africa. And we need to, you know, look at new technologies that will harness wind, sun, and hydro, you know, more efficiently than we currently do. So it's something that I think, you know, the entrepreneurs on the continent need to focus our energy on. Then coming to Clara's thing about curricula, and I'll stop at this point. I was invited to speak to anesthetic folks in the anesthetic field and surgeons on climate change in the context of training of anesthetists and surgeons. And I raised to them, you know, the issues around their practices and the buildings in which they practice. And there's a large number of things both anesthetists and surgeons can do to reduce their own carbon footprint. Now, in the African context, people might argue, look, we don't have anesthetists and we don't have surgeons. There's a long waiting list of people waiting for surgery. We should rather focus on fixing that problem rather than talking about climate change. But I think these two things can go hand in hand. So there is a program at the University of Cape Town that I teach at, which focuses on climate change and anesthesiology, climate change and surgery, to kind of look at, you know, how these two disciplines in particular, because it is part of a global surgery program, need to change their practices. And anesthetic gases, for example, are significantly worse, even though the volume is low, than both methane and carbon dioxide. There is a process now underway through the Public Health Association of South Africa to look at undergraduate curricula and how climate change can be included in undergraduate health science faculties in South Africa. So there's a whole process to determine these curricula in South Africa. Thanks, I'll stop there. And again, thanks for the opportunity.
Yeah, thank you very much, Jordan. Yes, our time is up, but at least let me allow Teshna the opportunity since her hand was up. Yeah.
Thanks, Georgina. So I'm a family physician involved in undergraduate and postgraduate teaching. And as much as we'd like to include climate change education, the one big challenge is there's no urgency as far as students and consultants are concerned. Africa has a quadruple burden of communicable, non-communicable accidents, etc. And so climate change doesn't have the same urgency as other problems that we deal with. We've tried to include students in the conversation about climate change. And one of the things that we've done is, so I run a diabetic clinic, and we've asked students to interview patients about the acceptability of plant-based diets, especially patients with cardiovascular disease. So these results are still pending, but it definitely is an extreme mind shift to think about how we can mitigate climate change. On another note, so we're organizing a conference and we're trying to see how we can be carbon neutral. And it's really more complex than we think. So for example, we said we didn't want to have posters because printing and laminating posters, it contributes to global emissions. But if you have screens that are using electricity, there's also an impact on the ecology in that way. So it really requires a lot more thought. Thank you.
Thank you very much, Krishna, for that. So colleagues, I think we may need more time to exhaust this, but I think this is just the introductory part of the topic, and we'll find time to deliberate more this. But just to conclude, for us in AfriHealth, we are also looking within. And so our symposium has climate change as part of our theme and then a sub-theme. So we invite you to submit abstracts if you've done some work, or you can also offer to be a speaker based on the work that you've done, you can reach us. You have our email address already, so you can reach us through that. So let's look within, as we've been told. Checking the curriculum of our health professions education, our own practices, wherever we find ourselves, especially in the health service delivery area, looking at our infrastructure and also knowing that we can't do it alone. We have to go in together with others. That's the One Health concept. And I believe that we'll be able to help our continent, since we are the major sufferers of climate change. Thank you very much, Dr. Umar. Thank you very much, Yogan. And Maria had to leave for another meeting. Thank you very much. Not forgetting Elsie, our president, who led this, and then Achest as well. We are very much grateful to you for your good work, and then also for staying through till this time. Enjoy the rest of the day and the rest of the week. Bye-bye to everyone.
Bye. Thank you very much, everyone.
Thank you, Georgina.